Hello, my name is Bhawna Sirohi. I am a GI cancer specialist and also the medical director at BALCO Medical Centre in Raipur. I am going to talk to you today about colon cancer. March is celebrated as Colorectal Cancer Awareness Month, basically to increase awareness, knowledge about colon cancer, which is the cancer of large intestines, which also includes the rectum and the anus as well. All of these are grouped under one heading. How does colon cancer develop? So colon cancer develops from polyps which arise in the colon or rectum, and it can take up to a decade, 10 years for a polyp to become cancerous. So colon cancer is one cancer which lends itself very easily to early diagnosis, because by checking for the stool, occult blood test, one can see if the stool is positive for occult blood, maybe the adenoma has bled at some point in time, and one can diagnose colon cancer at a precancerous stage, which is stage 0. So it's very important. I'll come to the symptoms of colon cancer, that if you have any of these symptoms like bleeding in your stools, weight loss, or change in bowel habits like constipation alternating with diarrhea, or any of these, not having a normal bowel motion for more than 6 weeks, if you have a lump in your body, or if you have a drop in your hemoglobin, if you have a low hemoglobin, all of these could be signs of colorectal cancer. You must get yourself checked out. By checking out, I mean you do a stool occult blood test. If that is positive, you have a colonoscopy, where we put a camera down in the colon and examine the colon if there is any cancer. This is how it is diagnosed, and if we see that there is something in the colon, it may be a polyp, or it may be an ulcer, or it may be a growth, we take a tissue from that and send it for something called a biopsy. The biopsy takes 2-3 days to come back, and that tells us whether you have cancer or you don't have cancer. Once we know that you've developed colon cancer, then we go about staging it. We want to know whether it has spread to other organs, for which you will have a whole body CT scan to see whether it has spread to other organs, and based on that we plan your treatment, which could be surgery, chemotherapy, or radiotherapy. And all of these modalities are extremely important in the treatment. A multidisciplinary team, which we have regularly at BALCO Medical Centre, decides whether you should have radiation or chemo first, or whether you should have surgery first. Some patients may need a surgery first, some patients may need chemo or radiotherapy, or both before surgery. So the complexity of decision making is decided in an MDT or a tumor board. And it's very important that if you're diagnosed with colorectal cancer, that you see a team which has all of these 3 members represented in that team, who talk to each other and then come back to you with what we call shared decision making, and take your choices into account as well. So once you've had your treatment, then you are followed up regularly. I'm also just going to talk to you about why we are so worried about colorectal cancer today. It's rising at a very fast rate, especially in India, and we are seeing it more and more in young people. By that I mean people less than 50 years of age. It's called early onset colorectal cancer, and we don't know the reason for that. And to find the reason, we actually from BMC applied for a research grant to Cancer Grand Challenges, which is held annually in UK, a combination of 2 largest cancer charities in the world, National Cancer Institute and CR UK. We applied for that to look into the reasons for this, and in collaboration with our colleagues in US and UK, we won that grant. And we are going to see, especially in the states of Chhattisgarh and Kerala, as to why so many younger people are developing colorectal cancer, whether there is something in the stool microbiome or the metabolomics. Microbiome is very important. anything can change a microbiome, whether you have more amount of yogurt or less, whether you've had a lot of antibiotics, what your diet pattern is, whether you're vegetarian, non-vegetarian. So our research is going to focus on that. My last word to you would be that don't ignore anything that your body is telling you. If you have any symptoms that is not getting better over a period of time, I would say 4 to 6 weeks, go and get these checked out by a doctor.